Do you suffer from sudden facial pain, jaw tension, headaches, or weird symptoms that doesn't make any sense? Like one day it feels in your jaw, then in your teeth, then in your cheek, and then it turns to headache. If that sounds familiar, this video is just for you. In this video, we'll be talking about the trigeminal-related pain, including TMJ issues like jaw, joint pain or clicking, bruxism, meaning that teeth grinding, tension headaches, or facial pain or tool sensitivity, what seems to move around. And there is one big question. Why these structures are so important? Why does the symptoms feel sometimes sharp and electric and other times warm, spreading like or flowing across the face? That is exactly what we're going to cover today. My name is SAKKINEN, I'm a physiotherapist, and I've spent over 10 years working with the people who deal with the persistent pain and complex symptoms like these. My focus is to helping people to understand their bodies and heal with the safe, science-backed methods, not aggressive quick fixes that often backfires. And I've seen this principle help many people regain the control over the symptoms once felt confusing and scary. So, if your facial pain feels like a mystery, don't lose your hope. Understanding the trigeminal nerve and how to calm it is a proven path towards the relief. A lot of people are told their facial pain is just stress or just muscle tension or just jaw joint problem. But clinically, that explanation is often incomplete. One key player here is the trigeminal nerve. It's cranial nerve number 5 and the main sensory nerve of the face. And it also controls your main chewing muscles. It has these 3 branches, and that's why the symptom can be shown around the eye, or upper jaw, or lower jaw, or even in the teeth or sinuses or templates. And there is a really important part. All of those signals travel through your brainstem before you experience them as a pain, pressure or tension. And your brainstem isn't about the strength or flexibility. It's about the basic safety, regulation and threat detection. If your system feels like threatened, the brainstem can amplify the pain signals and muscle scarring, even if nothing is really structurally damaged. Now, quick anatomy, and I'll keep it simple. The trigeminal nerve has 3 branches on each side of your face. One branch covers the forehead and the eye area, one branch covers the cheek and upper jaw, and one branch covers the lower jaw and chin. Each branch exits from the skull through the small opening in the bone, and they travel under the facial muscles. And these are the 3 key exit points what I want you to know. One is above the eyebrow, one is at the mid-cheek under the eye, and one is at the front of the lower jaw. And these points line up vertically with the center of your pupil when you look straight ahead. And why does that matter? Because of the tightness or the pressure in the muscles over these spots can sometimes aggravate the nerve as when it comes out. And knowing these landmarks help you to understand the pain and also helps you to do the gentle check. So now we're going to cover quick self-test. Let's do a quick self-test. Now, this is not push into the pain test. This is just sensitivity check. First, gently press just under your eyebrow, around the center line of your eye, and only put the pressure gently. Second, gently press your cheek just under your eye, in line with your pupil. Third, gently press your lower jaw about 2 to 3 centimeters to the side of the center of your chin, roughly estimated 5th or 6th tooth. So now what you are looking for, this should not be painful, and if one of these spots feels unusual tender or give you this sting feeling that feels familiar to your symptoms, then that can be a clue that one of the branches is extra sensitive. If they all feel normal, just pressure, that is also useful information. It could be still nerve related, but no irritation is at the surface. And if you're currently in a severe flare-up, skip this test and do it later when the things are calmer. Now, why the symptoms feel so random? Because of the trigeminal nerve network spans multiple areas in your face and head area. Irritation of the one branch can create referred pain to the other area. So the jaw tension can radiate into the templates or the forehead as the headache. Facial tension can be felt also as a tooth pain, or it can bounce between the different areas. And in some trigeminal condition, pain can be even felt in sharp electric shock like sudden offset feeling. But for the other people, the sensation is totally different. It can be felt as a warm, spreading, flowing, like water running on the skin, or something is bleeding under the surface. Those symptoms qualifiers often reflect different types of the nerve irritation, and here is the key takeaway. That is very different from the simple muscle ache. When we are suffering from the nerve issues, what is really fast going on and going off, it's like an electric sharp feeling or stuff like that, then the nerve what has myelin sheath, top of those are the one what does your typical symptoms. When we are fighting with the nerve pain, what is not myelin sheath related, then we have these warm sensations going on in the area where we feel the difficulties or the pain present, and that is because of if we have the nerve roots what are not covered in myelin sheath, those typically cause different kind of symptoms compared to the nerve what have these myelin sheath on. Why? Stretching makes it worse. And this also explains why stretching harder or forcing the jaw movement often makes things worse during the flare-up. If the nerve is sensitized, aggressive movement is interpreted as a threat. And when the system senses threat, the brain can respond to the more pain and more protective tension. So if someone says, just stretch it and you feel worse, you are not weak, you are not broken, it's your nervous system doing its job, it's trying to protect you. Modern pain science gives us good news. In most of the cases, recurrent jaw or facial pain, nothing is physically broken or damaged. Many people with chronic facial pain have no clear structural cause. Instead, the problem is often nervous system and its sensitivity, daily load and stress, and how safe or threatened your body feels. Pain is more like a warning signal. It's about the perceived danger, not just physical harm. And if your nervous system becomes overprotective, it can send the pain even after an injury or injury has healed or in response to minor triggers. That's the reason why the calm approach works better than aggressive one. Calm, safe signals to your nervous system will beat the brute force in treatment in the long run. So, if your symptoms has been felt randomly or confusing, now you know the reasons why. And here is what matters the most. When the pain is high, the goal is not the mobility. The goal is reduce the threat and calm your nervous system. And in next video, I will going to show you exactly what to do during the trigeminal pain flare-up and what not to do step by step. Calm first, mobilize second, and that is the order what matters.